The experience with diabetics and COVID has been an interesting one. From the beginning of the pandemic, has shown some variation during the pandemic, and indeed we're still in the pandemic. But we're also seeing or now recognizing how diabetics are and the risks that they have post-infection. And in particular, some complications of diabetes like kidney disease, or those who have chronic kidney disease as a result of diabetes, were significantly impacted by the virus itself. And we can understand that because not only is COVID-19 a respiratory virus, we now know that it is also a vascular virus. This means that the COVID virus interferes with the blood vessels of your bodies. And in particular, it causes damage to the inside of the blood vessels, causing a cascade of reactions or a number of reactions on the inside of the blood vessels that can lead to multiple things, including blood clots. Well, the pathophysiology of diabetes, meaning the disease-forming part of diabetes, is also very, very similar. And it is for that reason that diabetes and COVID-19 virus seems to be eliciting such similar damages to us and causes really sickness and in some cases death. So that kind of similarity puts diabetics at a very interesting crossroad where you now have to figure out in your mind how you're going to protect yourself because you now have a disease that damages your blood vessels. But at the same time, you're exposed to a virus that does similar damages to your blood vessels and can cause to have things like strokes and heart attacks and even exacerbate kidney failures. So in the process of doing education and COVID education, diabetics would frequently ask those questions. How does COVID-19 interfere or interact with me being a diabetic? And so that's why I led out with that discussion, because that, in fact, was the most common question that person seems to ask. Let me add here, however, that in the now era of the vaccination, I have found that there is a sort of a misunderstanding that diabetics have as it relates to the vaccines. In fact, a lot of diabetics seems to think that because they have diabetes, they should not be vaccinated. In other words, they call diabetes an underlying condition. And to their mind, diabetes is an underlying condition and they should not take a vaccine. Well, nothing could be further from the truth. The fact is the COVID-19 virus kills ravishly persons who are diabetic. If you look at the amount of persons who died from the COVID virus, many of them are diabetics. And so because of this, I've had to explain to the audiences that because you're diabetic, it means that you are at increased risk of dying from the virus. And as a result, you should be front of the line to get your vaccine because you need to protect yourself as much as possible. We've also found a very interesting scenario that we're now trying to figure out what's really going on. And maybe it's easiest if I give an example. I had a 32-year-old male who tested positive for COVID. And within a few days, he developed a very serious complication and had to be admitted to hospital for COVID-related complications. Well, in the hospital, the first strange thing that happened is that his blood sugar started to go up. Now, when people are sick, normally your blood sugar goes up anyway because that's a way of the body responding to sicknesses. But his blood sugar went up to the extent where he was actually diagnosed with diabetes. And not just diagnosed, he was diagnosed to the extent where he actually had to be put on treatment for diabetes. When he left the hospital, of course, he had a diagnosis of diabetes. That was an interesting discovery. By then, I took note of what was happening and found out that there were some other persons who were experiencing similar issues. They were not diabetic, or they thought they weren't diabetic, or maybe to put it more scientifically, their diabetes was not diagnosed. But after COVID infection, they now are outright diabetics. So that's one example. A second example is people who have been diabetics before becoming COVID-19 positive, or hypertensive before becoming COVID-19 positive, well controlled on diet or medicines before COVID-19 infection, suddenly find themselves in a situation where after they've been infected with COVID, they are now unable to control their blood sugars or unable to control their hypertension. I have seen this scenario play out so many times, which brings me to a sudden realization, or probably conclusion, if you want to put it that way, that COVID-19 seems to speed up or exacerbate things that you've already had in your bodies. So to my mind, these newly diagnosed diabetics were people who probably were pre-diabetic before COVID infection, or persons who were at high risk of becoming diabetic prior to the COVID infection. And they probably did not know, because maybe many of them did not get their blood test done and the HbA1c. And so COVID simply sped up the diagnosis of diabetes. And I'm realizing that COVID seems to be a virus that does that type of thing. I had another friend who have had a long-standing, very dangerous medical condition that he always knew he was at risk of having because of the high probability and the high prevalence of it in his family. So he was very aware that this is something that could actually happen to him. And after becoming COVID-19, exposure to COVID-19, the condition showed up itself. That's an interesting scenario that is playing out for us here. And that's one reason why we need to be very careful. We need to make sure we control our blood sugars and pressure as much as possible. So for those of us who are diabetic, and I'm not diabetic yet, so maybe I shouldn't say those of us, but I know I'm at risk of diabetes because everybody on my mother and father's side, uncles and aunts, everyone has diabetes. And I know my own generation, my older cousins are diabetic, so I know I'm at risk of it. But, we just need to understand that if you're diabetic, no matter what conditions you have, COVID-19 tends to exacerbate these types of things. And viruses tend to do that because I did remember saying sometime before that even in the days of the chikungunya, we have found that people who have had chikungunya continue to have complications of the chikungunya up to 3 years after the chikungunya has gone. So if you're diabetic, and your kidney function is on the borderline, or maybe your cardiovascular system, your heart, you're on the borderline of heart failure. And so many times diabetes come with the famous triad, I like to call them. So most diabetics would have hypertension as well as high cholesterol. And those with high cholesterol tends to have hypertension and diabetes. And those with hypertension tends to have diabetes and high cholesterol. So those famous three tends to go together. And so what we're seeing for some diabetics who may have had good control pressures or who may have had good control cholesterol, suddenly after the infection, after getting COVID infection, these diabetics now start having these two other conditions, which are cholesterol problems and hypertension problems. So again, it's yet another reason why we have to take these whole COVID-19 infections so seriously as it relates to diabetes. We're also seeing something that we now call the post-COVID syndrome. After they've had their 14 days of infection and recovers from COVID, whether you recover less than 14 days or after 14 days, these are people who develop prolonged COVID symptoms after full recovery of the disease. And these symptoms can be COVID-related symptoms, and they continue to have those prolonged symptoms. And this can go on up to 12 weeks after complete recovery of the COVID infection. We also have a scenario where someone who has had COVID infection recovers from COVID, and after the COVID infection has recovered, they developed new COVID symptoms that they did not have when they had the active infection going on. And again, this can go on up to 12 weeks. So we now call these things post-COVID-19 syndrome. Again, diabetics are at increased risk of having that type of problems because of, again, the vascular nature of how COVID causes this disease, similar to the vascular nature of how diabetes causes this disease. Some of you who might be listening to my deliberations today might be men. So, and you might be young men. You might be a young man with type 1 diabetes, which is insulin dependent, or you might be a middle-aged man with type 2 diabetes, which are diabetes that corresponds or responds to oral medicines or tablets, if you want to call it this way. For the men who are listening to this, let me be very clear and candid with you. Diabetes interferes with the blood flow of our vascular system by causing damages to the inside walls of your blood vessels. And these damages in the walls of the blood vessels causes cholesterol deposits and lipid deposits to get stuck in those little potholes, if you want to put it that way. And the more they get stuck, the more they build up onto one another. And then the body has a sort of a mechanism that goes into place whenever there is blockages in the blood vessels, and it leads to plaque formation. And over the years, these plaque formation cause a decrease in the flow of the blood into the blood vessels. And that's what leads to peripheral vascular disease, as we call it in medicine. But locally, you can say this is what leads to circulation problems in diabetics. COVID-19 worsens that situation. So for the men, I'm going to speak specifically to you. The erection of a man happens because of blood flow into his penis. And men must understand that. Blood flow must flow into the penis in a very undisturbed way, an uninterrupted way. It must get into the penis and must saturate the muscles of the penis, and the blood must get stuck inside there so that a good erection can happen. For many men, middle-aged men especially, who are diabetic, the strength of your erection is a very good indication as to how much damage this diabetes is eliciting on you, on your cardiovascular system. Because the same blood vessels that supplies blood to the rest of your body is the same blood vessels that supplies blood to your penis. So in other words, for the male population, the strength of his erection is like a temperature, is like a clock or temperature regulator, if you want to put it that way. In other words, the strength of the erection indicates the onset of cardiovascular disease. And that is something men who are diabetic must internalize very, very much, because it's a very serious matter, especially in relation to COVID. Because remember, as I said earlier, the way COVID causes its disease is much similar to how diabetes causes its disease. Diabetes damages the inside of your blood vessels, causing cholesterol to deposit there. COVID-19 does a similar thing where it damages the inside of the blood vessels and can lead to clots being formed and organ failure being formed. Also recall, I indicated to you that it seems to us that COVID-19 simply fast forward a problem that you may have had lurking in the background there before. So it looks as though the men who are diabetic, who are on their way to develop erectile dysfunction, who may not have had erectile dysfunction yet, but if they get COVID-19, COVID-19 simply speeds up or fast forward the erectile dysfunction. And that's why so many papers are now written that demonstrates that men who get COVID can actually develop erectile dysfunction as a result of the COVID infection. So especially for our men folk who are diabetic, this is a very serious matter because, of course, it tells you that you are at risk of cardiovascular system, notwithstanding the emotional and psychological pressure that this event will put on you as a man, knowing and understanding how important an erection is. So if you're a diabetic, first of all, try your best not to get COVID, because we've seen what COVID can do in men who are diabetic, or people who are diabetic, so to speak. If you have not had COVID yet and you are diabetic, first of all, try to protect yourself by following the measures. The measures are always going to work, which is the hand sanitization, keeping a sensible distance, wearing a mask successfully. and give consideration to be vaccinated. Give consideration to the vaccines because the vaccine have met its objective by preventing hospitalization and preventing death. So first of all, as a man who, if you're diabetic, consider vaccination. If you have not had COVID yet as a diabetic, then it's critical that you practice the things that will protect you from infection. I'll practice the treatments that we give to persons who are infected. So men and people who are affected with diabetes but not COVID yet, ensure that you have your vitamin C available to you. And as a matter of fact, we shouldn't be having to tell any one of you that because we live here in the tropics and fruits and vegetables are so common. We shouldn't have to be telling you have your fruits and vegetables. But in any case, let's say it anyway. Have your vitamin C, which is very important for immune system to function. Another very important vitamin is E. Vitamin E is critical in the protection against COVID and even in the treatment for COVID. And so you really want to have a lot of that on you. For the vitamin E, one of the richest sources of that for diabetics who are during this pandemic is pumpkin seeds. Pumpkin seeds have a very high source of vitamin E. Of course, you can also Google other causes of vitamin E. And I think for us, this is one of the few times when this old myth about Lambi, by the way, it was Lambi and not Lambi, but anyhow, that's another story. This is when the only truth to the myth about Lambi is that, yes, you do get quite a bit of vitamin E coming from that as well. And even to a certain extent, zinc. And then, of course, zinc is the other important one. Zinc ensures that door is open for that stoppage of the multiplication of the virus to take place. So zinc is an excellent source. But in particular zinc, you probably want to use the dietary source of the vitamin of the zinc, because what we've noticed in some studies is that the pharmaceutical or the pharmacological source of the vitamin of the zinc tends to increase blood pressures in some people, whereas the dietary source of the zinc doesn't do that. So you probably want to eat your zinc rather than take it as a tablet. But the point is you need to have these things around, especially if you're diabetic, because those are what you're going to use to keep your body strong and healthy, protect you from the disease. And if you do get the disease, it actually helps you to recover, your recovery rate to be very short. So this is where I'm going to leave it now for our diabetics. I wish all the best. I know a lot of celebrations is coming up. There is nothing more powerful than taking control of your diabetes. As I've said to some of my friends before, as a physician, whenever I write a prescription for a diabetic medication, it feels as though I am now handing over your care to a pharmaceutical company. And it does not make me feel good to have to write diabetes medicines. I always feel better when we work together as patients and physicians to use whatever natural sources we can to control our blood pressures and our blood sugars and our cholesterol. And let's not have to rely on medicines, because at the end of the day, all medicines have some sort of a side effect. So I wish you all the best and keep as strong as you can. And let's keep ourselves, our families, communities in our country safe from the pandemic. Thank you.